Patients should be screened for colon cancer because it is the second leading cause of cancer-related deaths in the United States among both men and women. And we have tests both to find cancer early as well as actually do tests that help prevent colon cancer altogether. I tell all my friends and family and anybody that I meet that I think might be willing to listen that colon cancer screening is really an essential part of good health care. It is the most preventable cancer, and with a simple test can be detected early. I personally recommend colonoscopy since it is the single best test to identify both colon cancer as well as identifying precancerous polyps and having them removed. The essential part, though, is that all patients should choose some form of screening. All patients should be screened at some point during their lifetime. Patients who have a family history need to be screened earlier than their relative had developed colon cancer, but the general population should be screened starting at age 50 till age 75. For patients who have a first-degree relative or multiple second-degree relatives, we recommend that they begin colon cancer screening 10 years before their youngest relative developed colon cancer. There are several different tests that are available for colon cancer screening, and patients should choose the test that is most comfortable for them. There are tests that involve a procedure, such as colonoscopy, where we look inside of the colon. There are other tests that begin by looking for microscopic blood, early signs of colon cancer within the stool. And then there's imaging studies such as CAT scans that can also be helpful. There are several tests that have been designed to look at stool as a marker for early signs of colon cancer. One of the most recently developed one is a FIT test, which is a highly sensitive test looking for microscopic blood within the stool as a sign of early colon cancer or large polyps that lead to bleeding, which we then find during subsequent testing with colonoscopy.